Welcome to the Cerner Millennium Administering Medication on PowerChart e-learning video. Before you start, as always, check the blue banner to make sure this is the correct patient record on the screen. Here is the patient's name. Here the basic demographics. This shows the encounter details, location, etc. Before you administer any medications, you can view the drug chart. This is available from the blue menu on the left side of the patient record. First of all, we need to check the filter is set to what we want to see on screen. The filter selection list is here. We will change this to the All Active Medications filter. Select others as required. Please make sure this is set correctly to what medications your patient is on. The time view can be changed by adding or removing ticks as needed. Please make sure you have selected all that you need to see on screen. In our example, the ibuprofen is highlighted in red. This is showing it is late. It also specifies that it has not been administered. The date and time increment from the left side, so you can see what is to be administered and when. If you want to see more details on the order for the medications, this is available in this column. Any special instructions for this medication will be in this area as well. To record an administration, click the Medication Administration button on the toolbar here. On this screen, you can scan the patient's wristband to confirm it is the correct patient. If there is no scanner available, click Next button to override. From the drop-down, select a reason. For this example, we use No Scanner Available. Click Yes to continue. Again, if you have a scanner, you can scan the medication. If no scanner, you can select the medication by clicking and adding a tick to it. This will once again require a reason for the override. Same as the previous example, we will select from the drop-down that there is no scanner available. Again, click on the Yes to continue. Because we selected the ibuprofen, which from earlier screen we could see was not given on time, the early-late reason box appears. Again, select the reason and click OK. To complete the recording of this administration, select the Sign button in the bottom right corner of the Medication Administration window. We can now see that this medication has been administered to the patient. Hovering over will show who by and the date and time this was done. If we want to record that a medication was not given to our patient, right-click on the relevant drug and time slot. Then select the option for Record Not Done. Once again, supply the reason for this from the drop-down menu. In this example, we are choosing Patient is off the ward. Any comments can be added in the comments box to go with the reason if needed. Click on the green tick to complete and sign. Within Cerner, the PowerChart application does not automatically update. You need to refresh it manually regularly. This will then show the latest information on screen. In our example here, the overdue drug has been administered, but is not showing the update to reflect this. Clicking the Refresh button on the top right, the icon with two arrows in a circular pattern with a time duration next to it will then refresh the patient record to the latest update. Thank you for watching this e-learning video. Further videos are available on our YouTube channel called ELHT Cerner Millennium EPR e-learning videos.